welcome back to my channel, English for Nursing Communication 2. This is Ruffel Manalo from the Faculty of Nursing, Nakhon, Pathom, Rajabhat University. I will discuss to you about the Unit 13 on how to communicate with patients in the surgery ward. So again, this is a team teaching course taught by the three of us from the Faculty of Nursing. So for the objectives at the end of the course, each student nurses should be able to understand the care of surgical patients or perioperative patients, describe the surgery categories, identify the phases of perioperative nursing, explain the surgical consent, apply the pre-post operative teaching plans, analyze the surgical risk factors, and anticipate the possible post-operative complications. So in the care of surgical patients, patients need surgery for many reasons. So that is to find out the reason if there's any problem, reduce the problem, replace or take out tissue or organ, may also carry out as an emergency for some to save the patient's life, especially if it's an emergency surgery, and to correct an anatomical or physiological defects for some. This could be elective, mostly elective or planned surgeries, unless it is an emergency from a vehicular accident. And we have also to provide therapeutic nursing interventions. And the last one, to treat the pathological disease and injury of a patient. So the categories of surgery includes ectomy, oraphy, oscopy, ostomy, and otomy. Also, we have plasty. So first, we will discuss what is ectomy. Ectomy, this is the removal by cutting. Okay. Let's say the removal of the appendix. So an appendix, part of an appendix is being removed or cut, and it is called appendectomy. We also have oraphy. Oraphy is the suture or repair of, let's say, for women, reproductive problems of women. And oscopy. So oscopy, this is um, how it is done. The procedure is done by looking inside an organ to see if there is a problem. Ostomy, this is the formation of a permanent artificial opening. So the surgeon will perform an operation, which is the opening of a certain organ or part of the body. Otomy, this is incision or cutting into. Okay. Otomy is like incision and drainage when there is a wound. So this is categorized as otomy. And plasty, so formation or repair. So let's say face transplant, um, nose lift procedures, and many more. So the phases of preoperative nursing includes this. Okay, but let's find out first what is the meaning of perioperative. So perioperative, this is a term used to describe the entire span of surgery, including what occurs before, during, and after the actual operation. So we have the preoperative phase, we have the intraoperative phase, and we have the postoperative phase. So in the preoperative phase, this begins with the decision that surgical intervention is necessary and ends when the patient is transferred to the operating room. Intraoperative, this is the period where the patient is having an operation. And postoperative, this is where the patient is brought from the recovery room and soon will be transported or transferred to the patient's ward or room, private room. Okay, so this is how it looks like. In the perioperative assessment, review Pre-operative laboratory and diagnostic studies, review the client's health and preparation for surgery, assess physical needs, assess psychological needs, assess cultural needs. So, review pre-operative and diagnostic studies. So this includes laboratory tests. So certain laboratory tests and diagnostics are being performed. In review, health history, preparation for surgery. So we have to identify if the patient has a past history, past illness, current medical conditions, previous surgeries, if they have allergies, if they have bad reactions to anesthesia, if they have used substance like prohibited drugs, and this is also includes the review of systems. So next, we have the assessment of the physical needs. So we have to assess if the patient is able to communicate. We will check the vital signs, how the patient reacts by monitoring the level of consciousness. We have also to check the weight and height, the integrity of the skin. This is also how we determine if the patient is able to walk or not, and how they perform exercise. Is it um, let's say dependent range of motion or independent range of motion? Then we have also to determine if the patient has prosthesis. Prosthesis, these are like false teeth, okay, and circulatory nervous system. For the psychological needs, this is very important. We have to assess the emotional status of the patient, their level of understanding, how they cope. Support system. Support system, this includes their family members, okay, and the roles and responsibilities of the patient and other significant others present. And then the last one is the cultural needs. So language interpreter is much needed if the patient is foreign, or let's say if the patient has language barrier and don't understand the local language of a certain hospital care facility where the patient is being admitted for surgery procedure. So a surgical consent is very important. Why? Because this is done to let the patient understand, and the patient should be 18 years old and above, mature, and understands very well the procedure that is going to be done by the surgeon. And also, this informs the patient on the possible risks, the possible disadvantage of the outcomes. And surgical consent is very important because a nurse will be the one to explain uh, everything to the patient based on the patient's level of understanding. So during the pre-postoperative teaching plans, we have this. So as a nurse, we should teach the client about the procedure, the expectations before and after the surgery. Then we have also to alleviate the anxiety of the patient because some of them may feel uncomfortable, some of them may become anxious, and the family members can also participate in the recovery process. So the nurse will, once again, I have discussed a while ago that nurses should also include the family members in the pre-operative care of the patient. And information, detailed information based on the level of understanding of the patient is much needed. And this one, pre-operative teaching plan includes medication, like how they give side effects, or let's say how the patient's body react to the medication given before the surgery. And also pain control medications, explaining the patient about the anesthesia, and how the patient is monitored inside the operating room, and afterward, the patient is taught to do what certain exercises after the surgery. Then information about intravenous fluids, if there are such, like the patient is also having tubes, like nasogastric tubes and other tubes attached to the body. So preoperative teaching time also gives the client a chance to express how they feel. If they are afraid, they have to verbalize to the nurse so that the nurses also can play or can be an advocate how to comfort the patient. And when the patient is admitted for the emergency surgery, time of time of explanation is sometimes impossible to do, right? So what are we gonna do is we will just care for that. If there are significant others present, we have to explain to them. And if not possible, then we have to explain that further after the operation. So the surgical risk factors includes here the age. So if they're too young, if they're too old, and about the nutritional status as well. So malnourished patients, low weight or obese, this could also be the risk factor in surgery. Medical problems like chronic respiratory problems, acute respiratory problems, because sometimes anesthesia patients can react to the administration of anesthesia. Hypertension or HPN, liver dysfunction, renal failure or arrhythmias. So, in the physical preparation, a nurse should consider this nursing diagnosis because the patient could be anxious, or the patient could have been, let's say, confused or no knowledge about the procedure. So this occurs during the skin preparation, elimination of fluids, care valuables, clothing, grooming, and prosthesis. So a nurse should consider this nursing diagnosis during this time of physical preparation. As well as this includes psychosocial preparation because the patient should be relaxed before the start of the operation. And careful preparative teaching can also reduce fear and anxiety. So further discussions in comfort to the patient, somehow we can ease their anxiety and fears. Also, in the initial assessment, this could make the patient anxious. Okay, so we will check the patent airway, or the airway patency, effective respiration, presence of artificial airways, mechanical ventilation or supplemental oxygen, circulatory status, wound condition like dressing, drains, fluid balance like intravenous fluids, lavage, ability to void or bowel movements, and then level of consciousness and pain. So for the ongoing assessment, we have also to consider this altered respiratory function, pain, altered comfort, risk for infection, and activity intolerance, because we should consider this as a post-operative preparation for respiratory functions of the patient. As what I have mentioned, that some patients may react, okay, not one size fits all. Some patients react to the anesthesia. Okay. Then general condition, vital signs, cardiovascular function, fluid status, pain level, bowel and urinary elimination, dressings, tubes, drains, and IV lines. All right. So, what are our responsibilities as a nurse in the post-operative phase? So we have to ensure a patent airway. Okay. What else? Maintain adequate circulation. to avoid complications, prevent or assist with the treatment of shock if there is any, and maintain proper position and function of drainage tubes if there are any tubes attached, and intravenous infusion. We also have to monitor the fluid status of the patient and potential complications of the surgery afterwards. So complications includes hemorrhage, so we have to consider this. Okay, some patients may have unexpected hemorrhage during or after the operation, shock, hypoxia or low oxygen, aspiration. So as a nurse, okay, we have to what? Therefore, we are challenged to provide holistic, okay, care to our patients. So holistic means physical, spiritual, emotional, um, social, okay, such as comfort and safety during the entire perioperative experience of the patient. It's very, very important. So thank you very much. And if you have any questions, inquiries, please don't hesitate to send me a message through my email, line, and messengers. So thank you and see you next time.